All right, thanks, Diane. Hi, everyone. Thanks for joining us. So my name is Timur Durrani, and I work here in health services. A couple things I just want to point out. First is that this says COVID updates, but we're really going to be talking about respiratory viruses in general. So we'll talk about that. And the second piece is that this is really a team effort. And so you see, I'll be talking from health services. There's an entire team, some of which are on. And so I want you to realize that although it's me talking, we have a whole team that supports the lab. And we have nurses, nurse practitioners, all different folks that are operations folks, all kinds, just in health services. And then if you go even beyond health services, we have an entire division of environment, health, and safety where we sit. And so Laurel is one of our team members. And so what I want to point out is for everything that we're doing, it's a big team effort to try and get these things rolled out. So this is our agenda. We're going to talk about respiratory viruses, some definition questions that we get about epidemics versus pandemics, some of the sort of time frames that we've seen around public health orders, COVID in the news. Then we're going to move into sort of what the lab has been doing and what we're currently doing. And we'll answer, I think, some specific questions around vaccines and so forth, vaccine availability. This talk sort of stemmed from us wanting to give some updates. We know that respiratory virus season kicks off in and around October or so. And so there's a whole big team effort that goes around trying to plan for this. We were doing this pre-COVID, and then as COVID has come on, we've had even more effort put into this. And so the first thing we wanted to point out is that we're coming into this winter virus season. And so what we have historically thought about is really influenza, right? And then when COVID hit around 2020, we started to see, well, we're starting to see coronavirus. And then I think you've probably heard about respiratory syncytial virus, RSV. And that tends to be in a cyclical pattern around having some seasonality. We do have viruses that circulate all year round. So for those of us who are used to dealing with, let's say, kids in daycare or so forth, we will tell people who have kids in daycare that, you can expect to probably get one respiratory virus per month. And that's because we have all of these things that are circulating. And so we now have a scenario where we have year-round viruses and then our seasonal viruses. And some things have changed. We just have come out of a few years where people really weren't interacting with one another. And so we're seeing some differences that we hadn't predicted in the past with regards to seasonality. Now, influenza we can plan for. It's somewhat based on both geography and weather and things like that. So that's one that we have been planning for. And then we include all the rest of these other respiratory viruses. Some questions that have come up around we were in an epidemic, we were in a pandemic. When do we get to move to something that's endemic? What is the difference between a pandemic and let's say an epidemic? And so this is really just a definition and more to sort of set the stage to let people know that a lot of us have been in a pandemic or have been around a pandemic. And so on the right-hand side, you see pandemics that have been declared over the past 20 years or so. And some of these may sound familiar. We had SARS in 2004. We had swine flu, as people may recall, in 2009. MERS in 2012, Ebola in 2013, Zika, and now COVID. That's different than something that, so the point of that is to let you know that some of you or some of us have already been involved in some version of a pandemic, and we've all been affected by COVID. Epidemics, on the other hand, generally have occurred about every year, and they tend to be seasonal in nature. And so we have experience with this. And so the reason we point that out is just to let you know we have ways of dealing with this and planning for it, and that's what we're doing here. So one of the things that changed following COVID was, or as COVID came out, was we had a number of emergency public health orders. So we had the declaration of a pandemic, which has some public health definitions, and then we have some government type regulations that had come out with regards to emergency public health orders. And emergency public health orders allow for a variety of things to occur in government. And prior to COVID, it was pretty well understood in the public health realm that public health really has some of the highest level enforcement abilities within governmental institutions. We understood that in the public health realm. Not everybody else did, and that some of that, as you've probably seen in the news, may cause some consternation with people who say, well, can you, should you, things like that. But without the debate, just understanding how this works is that in March of 2020, we all remember that this emergency public health order was issued, and then it was rescinded as of February 28, 2023. That public health order, again, provides certain government regulatory authorities separate but intertwined overlap with pandemic, epidemic preparedness and responses. So the emergency public health order was instituted and then it was removed, but all the planning and all the responses continues to go on. These are just some headlines that I had pulled from the New York Times. It could be any newspaper. It's just one that I think people tend to read a lot. And so what you see is in this sort of cyclical nature, we see a number of variants that start to be recognized. And then there's concern around what are we going to do about it and how do we respond? And so the point of this is just to show that, in December 2020, we had this. In June of 2021, we had this. In April, we had it. In May of 2022, and then more recently in 2023. This is all something that we can predict. I don't know about predict, but it is expected. We know that there's a cyclical nature to this. And so some of this can tend to cause some anxiety when we see a new headline. But if you look at the history of the headlines, we know that this has been ongoing for at least the last couple of years. So if you go to the Centers for Disease Control website, there's a whole bunch of data that you can get there. And so we just pulled out one. And the point of this is to show you the cyclical nature of this. So what you see are hospital admissions since 2020. And so what you see is this sort of cyclical nature over and over again. And we're starting to see now at the end of last week, this uptick. And so the question will be, well, what does that mean? Are we going to have this? Are we going to have more hospitalizations? Are we going to have more sick people? Are we going to have more ICU overruns, things like that? So far, we have not seen that. But again, this is something that we're looking at, planning for, understanding, things like that. One of the questions that comes up often is, what do we expect for the future? How do we predict how this is going? What's going to happen? And more importantly, how does it affect me? How does it affect us? And so what you see in the bottom right-hand corner is another graph that comes from the CDC. So what you see in black are the rates, and we see the rates starting to increase over time. And then what you see in red is what is anticipated with a pretty wide variance rate or margin of error. And so what you can see is, well, what's expected and then what's possible. And that all goes into this forecasting and planning and so forth. Most of when we look at epidemiology, when we say, well, if I'm going to try and predict what's going on in the future, let me understand what's happened in the last couple of weeks. And so that's what that's based on. And so, again, using that information to try and understand and to try and figure out how to plan. All this is being done in real time and trying to figure out, as a lot of us remember, well, maybe we need to go into a masking scenario. Maybe we need to do X, Y, and Z. And the lab has protocols, which I'm sure Laurel will go over, that describes how we try to respond and anticipate for that. So some questions that have come up. So what's going on at the lab? In June, we had 11 cases. July, we had 11. August, 36. And September, we've had about 13 so far. Generally, what we have found is that the lab tends to outrun or outpace in terms of time what we see in the community. So we will see an uptick before we'll see in the community. I'm not sure why that is. It's an interesting research question, but we generally tend to see things happen on the lab as a sort of microcosm before we see it out in the community. And so that gives you the numbers of what we see with regards to what's going on COVID. We still recommend vaccination. We still recommend getting boosted. Masking continues to be recommended for those who have underlying health conditions. And then if we have, we'll go into this a little bit more, but if we have an exposure at work, we have an entire program and we have people dedicated to evaluating, contact tracing, getting both the clinical advice, but also all the things that need to go into sort of a workplace environment to make sure that people are supported. This is a new slide that we put together some questions. There's a lot to read there, so I won't read it all to you. But what you see on the right is the general contact tracing workflow that the CDC uses and suggests. What you see on the left is a lot of the description of how this is done. What I want you to take away from this is that we have a robust program that meets all the requirements from state and state authorities and so forth around workplace exposures. And we're following what's both required and what we think is the best science of what's available out there. And so if we have somebody who has a workplace exposure, we will go through and conduct a contact trace. That is done by occupational health nurses, nurse practitioners. We have an entire team that works on that. And we get testing out and so forth. So what I want to convey is the confidence that I have in our team. Our team is available during business hours. Generally, these tend to be pretty routine, and so we are able to do the contact tracing during business hours. And we can get I think, good advice. We have templates. As you can imagine, we've done this a number of times, so we have the ability to respond, in my opinion, appropriately for our lab community. So a question that comes up around vaccines are, well, when are you up to date? So this is just a screen grab from the CDC. And so some questions that have come up around, particularly around the new vaccines. So when I pulled this, they were still waiting on the vaccines to be approved. They've now been approved. The issue that most places are running into, not just us, but when I talk to colleagues at other institutions, whether it's a hospital or let's say a pharmacy, is just supply chain and trying to get the vaccines. And so there are a number of recommendations around booster and so forth. We would tell you that we would recommend it. We likely are not going to have it at the lab. It has more to do with supply chain ability. We're seeing it that hospitals are having that issue in some of the pharmacies. And so if you have your healthcare provider, you can talk to them about obtaining the booster vaccines. And if they are running into, as we are, a lot of the supply chain issues around COVID vaccine. So what are we doing? We had been looking at, for those of you who've been at the lab for a while, you have seen that we have an annual flu campaign, and there's been a lot of planning that goes into that. That will start on October 3rd. We have our vaccines now, and so we will start our flu campaign starting October 3rd. If you go to our website, you'll see that we've got flu clinics that are scheduled bi-weekly from October 3rd through November 16th. And we try and get whoever wants to get vaccinated, employee, affiliate, contractor. If you're on site and you want to get vaccinated, you're welcome to come in and get vaccinated. This is a graphic that I borrowed from one of the presentations that we had here. So again, I like this idea of taking the flu vaccine, and it takes this from wild to mild. So with that, I think I will turn it over to Laurel.
Thank you, Timur. That was a great way to end your presentation. And I have to admit, I just got double shotted yesterday at Rite Aid with a COVID and a flu, and I'm feeling pretty good about that. So I'm here to give a refresher on our COVID protocols. And next slide, please, Timur, since you're managing it. I think one of the most important things that I think is important to convey is to stay away from the lab if you are sick, if you have symptoms. That has been one of the reasons that we've seen some outbreaks. That's been one of the reasons why we get workplace transmission, someone giving COVID to somebody else. So this slide summarizes two of the most basic things. One is, if you've been exposed to someone with COVID, whether it's at work or at home, a friend of yours, a family member, it is perfectly okay to come to the lab and continue on any kind of business travel. If you email the COVID info line or you report that to health services, we do always want that to be reported. You will receive guidance that you will need to wear a mask indoors for 10 days and take a COVID test after day 5. And we do provide those COVID tests to you. If you want them, you can always use your own at home. If you have COVID symptoms or a positive test, absolutely do not come to the lab or continue interacting with people on business travel. That may mean staying in the hotel and contacting folks for assistance in taking care of those arrangements. Call health services, and or you can email COVID info. It's always helpful if we have your name, ID number, and your phone. And part of the requirements will be to wear a mask for 10 days indoors. They will provide information to you on when you can come back to work. So I think of all the pieces of information, this is the one that we're hoping really strikes home with everybody. And it can go a long ways to preventing us from having COVID spread here, and definitely reduces our risk. So I am going to go off. I am going to go off the slides for a moment. And I would like to share the so you should be, that's not what I'm going to share. So sorry. I wanted to point out the COVID website for everybody. So that is here.
Laurel, do you want the URL and chat that?
Yes, let's put the URL in chat. So
Okay, I can do that.
Are the COVID protocols showing?
Yes.
The matrix. I do apologize. So this is covid.lbl.gov. This is really like your one-stop shop. And one of the nice things is that we're letting you know what the current county risk level is. Right now it's low and has been low for a while. And this color code matrix outlines the different requirements that the different protocols that we need to follow. Other things that you see here on the right-hand side. Let me do my little spotlight. On the right-hand side here, we have, you can click a link to go to the EHS website and get specific protocols. But what I'd like to focus on these protocols right now is this here. So just to bring it bigger, we're currently in the low, and there aren't a lot of requirements. Anybody can certainly mask at any time. It's always voluntary. Distancing is not required. Oh, I'm sorry. Distancing is not required. And the self-monitoring for symptoms, that's always important to do, but there's no form to fill out like we used to do. The other thing that I wanted to point out here is that if we get into a higher risk level, like a medium risk level, there isn't a lot that changes. The biggest change that we would see is right up here at the top. And if we go medium, people are encouraged to distance and avoid crowds. I saw a commentary in the chat from someone about wearing masks in meetings. Always a good idea. It's certainly voluntary right now. And then if we do get to high levels, and there are parts of the country that are starting to get to high levels, then at high levels, the biggest change that people will see is that masking is going to be required indoors, on the lab shuttles, and when sharing government vehicles. Stop share. And Timur, could you go back to, or I can go to the slides.
Sure, should I share?
Oh, actually, I can do that.
Okie doke.
Okay. So I'll just do this. Okay, going back to the lab's COVID website. If you were to click on the matrix, you can get a version that's in PDF that's maybe a little bit easier to see, and you can expand it to make it bigger. The one thing I wanted to show also was the COVID protocols. If you click this link over here on the right side, that will get you to the EHS COVID website. And we have a lot of information. The first two sections are the most important ones. The top one is all the protocols, and we have protocols for lab staff. We have protocols for when you're traveling, for when you are bringing subcontractors and vendors on site. There's some slight changes. Protocols for when you're bringing visitors, and then protocols for in-person meetings. And one thing that a number of meeting organizers have found is that in the protocols for meetings, there's a link to a planning guide, and that planning guide can be helpful in figuring out how do you want to address COVID at your meeting. You got a meeting of 200 people. COVID is still here. What are you going to say to people? And who can you go to for help? That guide will help, and that's in that protocols for in-person meetings. And then the newest piece of information that we have on here, Timur was alluding to, is a document that outlines this is what the lab does. This is what health services does when we're doing the contact tracing. Okay, now we will go back to the slides. And I'm hoping slideshow here. Diane, please tell me if I have run amok. Okay, so that's what I was just showing you. And let's see.
And I put that link in chat, Laurel,
Yeah,
so for the
thank
people
you.
who couldn't see it.
Great, thank you. So this is the slide that I had just shown you about the EHS website. And then lastly, I wanted to say, where do you go for more information? We've got the COVID website. We have EHS COVID website. And how do you provide input and feedback? We have a variety of ways. And that is the end of what I wanted to share. And I will stop sharing screen.
And we do have a couple of questions. Yeah, I don't know if you were able to read chat. I pulled them off for you because sometimes you can't read chat where you're going. So the first one is somebody said that they've seen, a number of their co-workers apparently coming down with COVID the last couple of weeks, and should we not be wearing masks when we're having meetings, any sort of gathering? What's your take on that, Laurel?
Well, right now it's a personal choice. The lab does try to adhere to what are the requirements that apply to us, and our requirements are driven both by Cal OSHA and by the Department of Energy. And the Department of Energy ties the masking requirement to the community level. We do see the community level rising. I don't know if it'll get to high. That will be a required masking, but certainly people are welcome to mask. Masks are still available in your work area. Today, I was in a training class, in-person training. I decided to mask today. I just felt more comfortable doing that. But I think the lab doesn't want to require something unless we've got a driver behind that. Encouraging, absolutely.
So Timur, I've seen a couple of reports in the media about hospitals now requiring masks. I don't know if you've seen that. I know Kaiser, a couple of the Kaisers have, and several of the counties are going to require hospitals, the people who work in the hospital, not necessarily the patients and the visitors.
Yeah, so I have to go and look. My understanding was they were going to institute masking again in healthcare centers for healthcare providers. I think Alameda County has announced that. I haven't seen Berkeley's. Generally, Berkeley will follow Alameda County, which means if that's the case, then we'll have a mandate for masking within health services for health services providers.
And so that would be the people in health services, not necessarily the people visiting health services.
Yeah, I'd have to look. In the past, it has been anybody entering. And so if they've changed that, I'd have to go look at the specifics. Generally, it was anybody entering a healthcare facility, and that a very broad definition of a healthcare facility. And so it was broadly applied and broadly required.
And
Robin put in, right now it's not covering visitors and patients, but just the workers, which is interesting.
Yeah. And so I think masking. Oh, sorry, Laurel.
No, it's okay. Go for it, Timur.
I was saying, masking has become another, another thing to try, another needle to try and thread. And so my suspicion is that it's an attempt to limit spread in a healthcare facility while trying to not impose other requirements on people.
And Alameda County just posted their order. Neither Timur nor I have had a chance to read that, but my first glance is it's the people who work there, not the people who visit there.
Yeah. Okay. So we had a couple of people ask about reporting COVID symptoms to health services. So Laurel, remote workers, even if I don't come to the lab, I'm a remote worker 100% of the time. Do you want to know if I have COVID?
You want me to take that one, Laurel?
Yes, please. I know that things have changed.
I've double checked with, so I think most of our team is on here. So so thanks, team, for being on. And yes, Department of Energy still wants to know all employees who have COVID. So even if you're a remote worker, we have to report that.
Okay.
And it's true. Sorry, Diane, we do have full-time remote workers who do travel to the lab, or who do travel for business. They might be living in Pennsylvania and they'll travel to Oak Ridge. That kind of situation still needs to have certain guidance and care taken, because that person is still an employee, and we do want to make sure that they're not taking COVID with them someplace else.
So follow up on that. Somebody asked, does the lab cover hotel expenses if you have to isolate while you're on travel?
You want me to take that one as well, Laura?
Yes, go ahead. I can chime in.
Oh yeah, yes. So I think the short of it is yes. And so if you have to, the question usually becomes a technical one of where do I put it and how do I do it and that kind of thing. And that it goes into your travel voucher budget, so forth.
And the travel protocols that we have available on the EHS website talk about that, and has a link for a document on what to do if you get ill or injured while you are on travel. And I work closely with the travel office. We are taking a fresh look at the websites and seeing where we can make some changes and make things more clear for folks. But the Department of Energy is very clear that that those expenses are paid by the laboratory.
Great. So clarification, somebody would like to know, does health service want to know if you're exposed to COVID, not just having symptoms?
Yes, we do. And Timur can back me up on that one. We definitely want to know if you're exposed. So you're at a party this last weekend with family, and one of your family members or one of the friends there calls you on Monday morning and said, hey, I just tested positive for COVID. Please report that, because we want to confirm with you certain information about whether you have symptoms, advise you to be watchful of symptoms, really tell you that if you've been exposed, you are required to mask in the workplace for 10 days and required to take a COVID test, which we will provide to you if you don't have one already at home. So we definitely want to know if you were exposed, whether it was from something personal or something at work. You can email covidinfo@lbl.gov, or you can call health services.
And when I call health services, I assume that the information I share with you is shared with just the people in health services?
That's right. Yeah. So everyone answering or in the phones and health services, all of our folks are medical providers. So we all follow all of our confidential medical information practices and so forth. So yeah, it's all covered there.
All right. Can I ask a non-COVID question? Common cold or RSV? How do I know?
It's a good question.
And this is really personal. I've been sick for the past week, so I stayed away from the lab, right? I tested negative for COVID, but man, this is like a cold that I've not had before. Let's put it that way.
Yeah, it's interesting. We get that a lot, and without some of the sort of, what I would say the molecular diagnostics, some very specific diagnostics, it's hard to tell because there's so much overlap. Because we'll tell people, well, you have fever, chill, runny nose, cough. Well, that, of those, I think, the number of respiratory viruses that we had shown, a lot of them have that. So it's pretty hard to be able to distinguish that based on symptomatology. There's some things that you may be able to get from, if you have a sense of where the source was or the duration or symptoms, or sometimes lack of smell, some specificity to that. But for the most part, we have a difficult time solely based on symptomatology to tell people if we think it's one or the other.
Does it matter?
Does it matter? I think, the reason we approach this as a respiratory virus season is recognizing that, it could be one of 13 or 14, and it may matter in the outcome for the individual. A lot of what we spend our time on is in prevention. And so if we can prevent it, then ideally we won't go down to the individual level. So it can matter for the individual, particularly because some people are more prone to severe infection from any of these: influenza, coronavirus, RSV, and so forth.
Okay. All right. Well, those are all the questions we currently have.
Okay. I got one.
You got one more that you
got?
Yeah,
one direct, which was just to remind people. So it sounds like Kaiser may be having some of the similar issues around obtaining COVID vaccine. And so they're telling people to wait until Kaiser has it. And if you go outside of Kaiser to get it, you may be on the hook for paying for that. So I think that they're probably, like the rest of us, subject to some of the COVID vaccine availability.
And I did see for some of the people who went to some of the pharmacies to get it, that the health insurance hadn't put in the right codes yet, and they were being charged for the COVID vaccine. And so they suggested asking first before you get it to make sure. And then if your health provider hasn't put the right, or your insurance company hasn't put the right info in yet, maybe you have to wait.
Yeah, Robin just put in, what is the charge? What I have seen is anywhere, I've heard, from $120 to $220. That's from people from organizations who are purchasing it from the vaccine distributor. So it may be even higher. That's just what we have seen when we've been quoted. The $120 is what UCSF told me they were paying, and the quote we got from our provider, from our distributor, was over $200.
So it sounds like it's a good thing to ask that question first before you roll up your sleeve and get the shot, especially if they're changing the software, they said.
Yeah.
Laurel, yours, you got the COVID and yours was 0. So
yeah. And I think that with our healthcare providers, that if we ended up having to pay out of pocket, we could later go back to the healthcare provider and get an adjustment or request reimbursement. I think it, of course, depends on your health plan. That's a great question to pose to benefits or to your health plan itself.
Let me see if I can get that from somebody in benefits, just to let people know, and we can just do a short article on something like that then, in case it's case we know when that's going to be fixed, if it is a problem for some of the insurance companies. Well, thank you, Timur, Laurel. Thank you, everybody, for joining us today. And again, call health services. They're there for you.
Yeah. Thanks for joining. Thanks for, I would say, on a number of levels. We understand that COVID is not going away, and so thanks for your patience in and around that, and thanks to our teams who are working on all this, because it is they're working hard on trying to keep the lab going. So thanks everyone for all your support.
Maybe all your health services people can come off in camera and wave to us so that we know you're all there.
Yeah.
A lot of them are.
I see them. I see their faces waving, or their arms waving. Yeah.
And so if you see those folks, I think I saw Celine on there. There's Leah. I saw Andy, Rangina, Nina. Did I miss anybody? Stephanie's there.
Angie.
Angie. Yeah. So thanks everyone. Thanks for all. There's a lot of work that they do behind the scenes. What I've noticed is when something looks like it's simple, it's because somebody's put a lot of time and effort into making it look that way. So that's that whole team. So thank you.
Thanks everybody. Bye.
Yeah, thank you.